Oh, people, people, people. The world is changing. No kidding. Things are very different from my first time here, which was up at NASA Ames. Things are very different from a few years ago. I'm going to attempt to fill your heads with facts and thoughts that will alter how you think about the future of healthcare, because that's my job. I'm an activist. Health data spigots, probably an unfamiliar concept for you, but I want to point also to my next book coming out. It's super patients. It's patients who extended medical science when the doctor said we're out of answers. It's real, and if you don't enable and support that, you're holding back progress. See, the explosion is important because knowledge is power, and data about what's going on in a person's case is power as well. I am a good friend of Helen Bevan of the NHS. This is her Twitter profile page. Keep your coins, I want change. We are activists. We really want change. You know, at Health 2.0 last year on stage, I said to Matthew, you know, the difference between analysts and activists, they're both useful, but if you study a problem for 5 years and figure out what's at the root of it and nothing changes, analysts just sell more reports and the activists get pissed off. All right? And that when it's your family member who's dying, that's no small issue. My particular case here, this is me 11 years ago when I had stage 4, grade 4 kidney cancer. My median survival at diagnosis was 24 weeks. Obviously, that didn't happen. My health data did not play a part in that, but my being very activated did. All right? So here I was 50 weeks later, one of those tumors had just shrunken. Immunotherapy is what I got. It's amazing when it works well. What happened after that, that was all in 2007. I was diagnosed and cured in less than a year. Then I spent a year learning about the e-patient movement, empowered, engaged, and so on. And in early 2009, I decided to try Google Health because my hospital had announced that they had a button to move your data into Google Health. Everybody said, how'd you do that so fast? Well, I poked the button and what came across was garbage, and it ended up on the front page of the Boston Globe with the headline, Electronic Health Records Raise Doubt. Google services inaccuracies may hold a wide lesson, they said. Well, excuse me, it wasn't Google's fault that my hospital sent them garbage. The relevance of this is if you don't know it's in your medical records and your families, then when some AI goes and looks at it later, it's going to freak out and or give you bad advice. This is personal. Get involved. Find out what's in your chart. A week after that happened to be the Health 2.0 Meets IX conference in Boston, and there was this guy I'd never heard of named Jamie Haywood standing there saying, we're here to negotiate the terms of your surrender from patients like me. And I'm thinking, this industry saved my life. What are people complaining about? Well, people started asking me to give speeches, and my life was spinning out of control. I'd just gotten out of cancer and the housing market collapse and everything. They said, what do you want your speech to be titled? And I said, I don't know. For now, just call it, Give Me My Damn Data. And they did. And it became a thing. That started spiraling around, and 2 years later, as Daniel just mentioned, TEDx Maastricht happened with this crazy man who is here in this room, Lucian England, who invented the patients included hashtag. The guy said he would no longer speak at any conferences that didn't support patients being in the audience, even if they were paying him to speak. He said, I'm not going to do it because it's not going to be guided properly. Well, at the end of my talk, I got them chanting, let patients help. See, my pitch is not who needs doctors or we're going to overthrow everything. It's just, please, I want to help save my own life, all right? So let patients help. Well, also there was a fellow you may recognize, Daniel, who was speaking on what's next in healthcare, and he told us about this Singularity University at NASA Ames, and invited me to come speak there. And the thing that I've told people ever since, and you're here so you don't really need to hear this, but it's distinctive. I've done more than 600 events in 19 countries now, talking about the future and trying to make it real. Almost everything I heard discussed at that conference, this is about curation, has come true or developed into reality. If you look at all the talks you hear about everything at all the conferences you go to, that's unusual. That's why I come back. Well, anyway, so here's a question. Why would somebody want to change the industry that saved his life? Well, there are a number of signs that the industry is optimized around something other than consumer need. And if you're an industry observer, that may not be a big deal, but if you're the sick person, that's a big problem. And the industry thus may sometimes totally fail to serve the ultimate stakeholder that it's supposed to serve. Now, as a professional speaker, I get invitations to go speak at conferences with all stakeholders. And it's government people, insurance companies, providers, and so on, and no patients. That's the genesis of Lucian's patients included. They don't realize the sick person has more at stake than anyone else. Patients are the ultimate stakeholder. Some data points. I'm a marketing guy. I worked in high-tech marketing all my life before cancer. Well, there's the perpetual cost curve. Well, but at least we're living longer, right? Well, no, if you look at this curve, this is life expectancy on the y-axis versus cost on the x-axis. We actually are not compared to others. Now, mind you, I am happy to be part of this health system. I'm happy to have had my life saved. But what I'm getting at is, why would patients be motivated to try to change things? Okay? Now, here's an overlay of this, and I'm going to add some numbers onto it. These are scores for the lovely concept called amenable mortality. This is deaths in a country from things they had the ability to cure. So if you're in a poor country, you don't get dinged on amenable mortality because you can't do Mass General type heart treatments. The U.S. is way out there on the right side, and the breakdown of this, if you drill down into it, this is a study published by the Bill and Melinda Gates Foundation. So they've got all these conditions across the type, everything from upper respiratory infections to epilepsy and all kinds of things. And on the left, the highest score in the world was from Andorra and then Iceland and Switzerland. The U.S. is way down below. I scrolled up here with a score of 81. And this is so we've got the highest costs in the world, and yet what we have the ability to deliver doesn't reach the people who need it. And this is exactly like, imagine your town buying the world's most expensive, fancy new fire truck and having it fall in a sinkhole. Well, this is a problem, if it's your kid who's dying. And then I have permission from the organizers of this event to say the voice of pure evil, overtly asking, who cares what you need? Now, some of you may have seen this news story back in April. Goldman Sachs asked, is curing people a sustainable business model? Yes, they did. You can Google that. And in fact, in there they say, this is the potential to deliver one-shot cures is great, but then, when you do that, you don't get to sell them any more medicine. And not only that, but they don't stay alive to infect other people. They said that in the article. All right? We're talking about mixed incentives here. And I'm not talking about overthrowing the system. I'm talking about giving patients power to save their own lives. Look, proposition carries tremendous value for patients and society. It could represent a challenge for people looking for cash flow. My response, ladies and gentlemen, I dissent. It's like, who the hell do you think you are? Now, I'm a businessman. I understand business. Revenue is good. Margin is good and all of that. But in the meantime, see, stuff like that is begging to be disrupted. I don't know if any of you have ever experienced disruption from the underside of the steamroller. I did 30 years ago. My industry in graphic arts got the hell disrupted out of it by desktop publishing. And all of a sudden, the ultimate stakeholder, the person who wanted a brochure or report printed, got their hands on fonts. And as I've said before from this stage, y'all were stupid with fonts at first. But then the workflows got better and you got more experience. And that's what's starting to happen in healthcare. You heard earlier today about the "we are not waiting" hashtag. This is what's happening as patients get their hands on information and tools. Okay? So Dana Lewis is the woman who was involved in the very beginning, one of the pioneers of this open artificial pancreas system that she and her boyfriend, now her husband, ended up coding. That's it. Those things on the desk there are her artificial pancreas. It started, as I said, with the hashtag "We Are Not Waiting." They were tired of the industry saying, another 5 years, we'll have an artificial pancreas for you. Did you know somebody with type 1 diabetes, any particular night, could die in their sleep? A baby with type 1 diabetes, can you imagine putting a child to bed in a crib and not knowing if they were going to be alive? They said, we're not waiting. Well, so Dana was telling her boyfriend about this data and calculation she's got to do, and over a period of a year and a half, and they blog this continuously, he just came up with this algorithm to look at the data they hacked into her glucose meter and her digital insulin pump, and he got really good, the difference between the blue and red lines. Well, and then they decided, let's close the loop. And they do it overnight. $35 Intel Edison pocket computer running this open source software with no doctors involved. It's not that they don't want doctors, but the industry kept saying, we don't have anything for you. That's my whole point. And if you follow that hashtag, OpenAPS, you can see they'll tweet their overnight, their blood sugar is controlled better than people who have a working pancreas. And they did it themselves. And they are not ignoring or fighting the FDA. They're working with the FDA to say, here's what we're doing. You might have some use for this. That's open source for you. And I just downloaded this today. So far, there are 951 people doing this. It is not a product. It's open source. It's like long ago there was Heathkit build your own radios. That's what you do. 7.3 million loop hours. Users experience fewer highs, less severe lows, more time in range. The authorities may come along and say, we're not sure you should be doing this, but guess what? If we've already done something that we value, we don't care whether you think it's important. Or even if you think it's possible. I'm not kidding. The resistance we get in this movement, I'm not one of them. So back in May, I tweeted this. Dana gave a talk a year and a half ago in Washington, D.C., and a Kaiser doc got up to the microphone, obviously a very senior, august guy, and just scoffed at her. And she basically blew him off and said, the mood really, these are not her words, was, get out of my face, you're wrong. And we don't need you anymore. We're doing fine without you. And the real irony here, is if the party in the relationship that supposedly has the authoritative knowledge is wrong and doesn't know it, and the person who lacks those credentials is right, because this is working. So our ability to create solutions of our own, my appeal here, remember I talked at the beginning about data spigots, health data spigots. If you want to disrupt the daylights out of this industry, which has massive inertia, one good thing you can do is liberate the data so that the people who have the problem can get their hands on it, because then chaos breaks out. I know firsthand when an industry gets disrupted by the job data getting into the hands of the consumer, new power arises. So here is somebody, her scientific credentials is that she is an illustrator. She uses Adobe Illustrator, and having two conditions, lifelong, she created a graphic to serve as the narration aid, the story aid when she met a new doctor. Noticing the coincidences, you can look her up and see how it turned out that this illustration that she created, now she hand-coded this, but hang on because we got people who are doing it automatically now. It helped her improve her situation. A skeptical commenter. All this self-monitoring movement is just another manifestation of our profound self-absorption. All right? My guess is it'll simply generate revenue and speaking opportunities for its aficionados. Excuse me? This is on my blog, okay? Well, so how did that pan out? See, so 6 years ago, we have the skeptics and the enthusiasts. Kate Sheridan was a kid who got a bad case of Lyme disease. She and her mother gave an incredible presentation that blew the roof off at the HIMSS Health IT conference back in March. She had been through 30 doctors, 15 diagnoses. She had gone from being that star student playing soccer to being immobilized on the couch in the living room. And the family, they tell the whole story in that hour-long talk. They were planning, instead of her having a great life of her own, having her be living with them permanently disabled. Her mother happens to be a PhD researcher at MITRE Corp. Don't let that stop you, okay? Because when they went to the next wave of doctors, she took that 1.5-foot stack of data and manually typed it all into Excel. I want you to picture the possibility that she actually had data spigots, all right? Because that's what I'm asking for. We took her lab data, her medication treatment timelines, but there was something else. She had 26 symptoms, and there was no data feed for this. So they recorded it themselves, started tracking their severity. All of a sudden, there is an N of 1 dashboard for her case. And they also added for each of those trials and symptoms, how she'd responded, came up with this timeline of her total symptom load. I don't know what happened. You can look up their story, Kate and Christina Sheridan. But look, they finally figured out something on their own, something that doesn't exist in the medical literature. And she is a student at Oxford now in the UK. She completely recovered. Yes. What really grips my gut is if I think of this, my daughter is a high school science teacher. If I think of her having lost out on that, I mean, she's heavy into synthetic biology, doing amazing things. If she had been basically immobilized by something like this, and I love the idea. And so look what she said in her part of that speech. We only spend 1% of healthcare venture capital on helping people manage their own health. You can change that, folks. Okay, can't tell you how powerful it is to be able to hold that journey in my hands. There are many patients out there who have far crazier stories but don't have the tools. Don't have the tools. I'm asking you to help us change that. And now fast forward, because that case was about 10 years ago that unfolded. Now we have Michael Morris, who is the new super patient star on the horizon. His story was just told publicly for the first time a couple of months ago in Washington, D.C. Colorectal cancer, he happens to be a developer. Have you heard of FHIR, F-H-I-R? He was able to code FHIR to talk to all 4 of his hospitals and put together patient data is siloed. Reactive, call me if you get sick. He says that's nuts. This is a low-quality screen grab. So here we have a treatment, the big circle, and we have 2 weeks of wondering whether anything happened before a scan is done. And he wanted real-time data. So he now is using his data across multiple hospitals, put together an integrated solution. What people who are doing this are saying is the most wonderful thing turns out to be that they don't have to go through the portal to get at their data. So even if the portal sucks, which is a widely reported rating, right, they can just go get the data directly. So watch FHIR. I'll be speaking next month at the FHIR Developer Days in Amsterdam, where we hope to have updates on all this. So look what he put together. He's a coder. He's a product developer, right? This is all the visits from, you can't read it, it doesn't matter. Google on YouTube, search for Michael Morris FHIR, and you'll find the whole talk. All the visits and all the incidences and test values. He created his own dashboard. Here's what I want you to do. Everybody create some tools that users can cobble together and mash up according to their family's desperate needs. Okay? And I realized, the business part of me all of a sudden realized, OMG, he's becoming a vertically integrated industry. N of 1. Right? He has the doctors who are helping him with things, but he's providing the integration. So, as I said, chaos will ensue when an industry that has been stable because the data was locked up gets cracks in it. Cracks are openings. And you can just drive in and so. Now, one last thing before I close. Pro-status quo skeptics will tell you patients don't want that stuff. All right? Well, so my hospital's CIO actually blogged of the 2 million patients in our system, not one has ever requested a download. Notice also just before that, download makes little sense since there's nothing a patient can do with it. Well, that's the chicken and egg statement, right? And transmitting it somewhere else makes even less sense since there's no place to transmit it to. Well, so I'm thinking, am I missing something? Because I never noticed a button to download my data. So I went to their tech support people and I said, so there is no download my records button, right? And they said, that's correct. As an activist, I am infuriated by stuff like this, all right? Notice also, he says, if this is something you need, medical records can best help you. I called medical records. Guess what they said? We don't have a way to do that. All right, but it's my data, my mom's. Well, a movement gets songs. For the nurse, you say trying to feed me something. Well, give me my damn data. Damn data. Give me my damn data. It's all about me, so it's... Song goes on for 3 minutes. It's fun. We demand a spigot. Look, this is serious, so it's good to have fun. There's Kate. I'm asking you to help us change that. Helen and I say, please, we want change. When I said, I got them chanting, let patients help at the end of my TED Talk where I met Daniel, I was directly riffing on Tim Berners-Lee, who in 2009 had a TED Talk that ended with the chant, raw data now. And what he said elsewhere is when you connect data together, you get power. Skeptics, beware. Max Planck, we heard about quantum computing earlier today. Did you know he got his Nobel Prize 100 years ago for his work in quantum physics? Does not triumph by convincing its opponents and making them see the light, but rather because its opponents eventually die. Importantly, a new generation grows up. That is the youngsters that may be you, or it's the people trying to eat your lunch from the underside who know that you're out of date, okay? So don't get stuck being a proud expert on an obsolete model. Enable radically disruptive data spigots. Set yourself on fire. Thank you.
Dave's on fire. So there's a lot of everyone here at some point may be a patient, and you've been a great advocate. If there's, again, one takeaway for people here to recognize for their patients or when they're patients to advocate for their own connectivity and data ownership, what would it be today that they can do with their system?
First thing to do is just proofread everything. If it's your chart, your family's chart, look for mistakes. A big Geisinger study on the front page of the Wall Street Journal Health section a few years ago found that 80% of charts contain mistakes. Some of them are small. One of my chest x-rays identified me as a 53-year-old woman. I don't know where they got that idea. But some of them are important. So just get involved, and please, if you're a physician, encourage your patients to do the same.
Great. Thank you, Dave.
Thank you.
Thanks.